Hello, my name is Stephen Navarra, and this is my presentation on Achilles tendinopathy, comparing the effects of therapeutic massage and low-level laser therapy. No one is immune to tendinitis. All genders, ages, and activity levels are included in possibly being affected by Achilles tendinopathy. Interestingly, one half of elite athletes come across Achilles tendinopathy at some point in their career. And while many studies have had more female than male subjects involved in them, there's no significant foundings that suggest findings that suggest that females are more prone than males to getting Achilles tendinopathy. Treatment, the best treatment is rest. Rest is best. Unfortunately, if we rested, it would take weeks to months to heal, and no one has that kind of time. That's where physical therapy comes in, and treatments are given to help speed up that process, get people back on their feet as soon as they can. A couple modalities used to treat Achilles tendinopathy is therapeutic massage and low-level laser therapy. These are just a couple among many treatment options for Achilles tendinopathy, but studies have shown that both of these have had positive effects on the injury when they are tested with eccentric exercises. So the purpose of this study is to find a statistically significant difference in swelling and pain rates in Achilles tendinopathy when treating the ailment with therapeutic massage or low-level laser therapy in isolation, to find if one works better than the other or if at all, and it was just the exercises the whole time causing the positive effect on the injury. This is a randomized control trial. The researchers have not selected the subjects at all. They will not determine what subjects are in what group. The dependent variable is the pain and severity measured by a visual analog scale and the Victorian Institute of Sports Assessment Achilles questionnaire. The independent variable is therapeutic massage and low-level laser therapy actually treating the Achilles tendinopathy. The subjects that are in the trial reflect the general population and the subjects that could be affected by Achilles tendinopathy. It's 20 men and 20 women that have been diagnosed with Achilles tendinopathy. There are no inclusion-exclusion criteria as far as gender, age, activity level. The only requirements are that the subjects are not on any medications currently. They're receiving no other treatments currently for their Achilles tendinopathy, and they have no other lower body injuries at this time or within the last 6 months. Of course, all of these subjects are volunteers. They have given the written informed consent to the study, and they will be randomly assigned into two groups. The subjects will draw a number from a hat, and then those numbers will be placed into the two groups, massage or laser therapy, by a random generator. The clinicians will not choose. They will be randomly assigned to massage or low-level laser therapy, but once that clinician has started that modality, they will perform the modality for the entirety of the study, and the subject will see the same clinician throughout the 4 weeks each time to give the study more consistency. The massage is going to be done for 15 minutes, and it'll be a cross-friction massage on a prone lying patient. The massage will take place from the base of the calcaneus or the foot to the distal end of the gastrocnemius, which is also known as the calf muscle. The clinician will use a massage lotion. They will be at the same height and, of course, use their best judgment to give the same amount of pressure for each time. This treatment will be done 3 times a week for 4 weeks. There must be 48 hours in between each treatment. The low-level laser therapy will be done with a Class 3B laser. There will be 3 points on both sides of the Achilles, making 6 points in total that the laser will be pointed at for 30 seconds on each point. The machine will be set to the same numbers each time, each treatment. The output and the power will never change. And this will also be done the same as massage 3 times a week with 48 hours in between each treatment. The data collection will be done using these 2 surveys, if you will. The visual analog scale, which is a 100 millimeter line. From left to right, it's marked 0 to 100, 0 being absolutely no pain at all, 100 being the worst pain ever. And the patient will mark down how they feel right at the moment of the test with their Achilles tendinopathy, and that's just pain that they're referring to. The Visa A questionnaire is 8 questions. It's scored out of 100 points. The higher the score you get on the questionnaire, the less severe your injury is. For example, if one of the questions is how severe is your pain and discomfort walking up the stairs, 1 being extreme pain, we could say 6 being no pain at all. Obviously, if they have all 6s, they will have a less severe injury, no severity at all in the injury. They will take these tests, these questionnaires, at pre-trial, at 2 weeks, and at 4 weeks, which is the end of the trial. Then all of those, all the data will be collected and given to the researcher by the clinicians. Then, to analyze the data, a paired t-test will be used to determine if there's a significant difference between pain and severity between the 2 groups, between the 2 modalities, and then an independent t-test will determine if there is a difference between the 2 treatment groups, between the 2 subjects, if there were more men and women in one subject or not, if there were more men or women or age range in one group or the other. The significance of this study is that Achilles tendinopathy is a common overuse injury. Almost anyone is susceptible to getting that injury, regardless of your age or gender. If you're an athlete, you're almost guaranteed to get some kind of tendinitis in one joint or the other. It doesn't have to be the Achilles. The Achilles is just for this study. So the 2 modalities that are in this study have been proven to treat it, but they've not been proven to treat the ailment in isolation. So we don't know if these are actually affecting the outcome of the treatment significantly, or if it was the exercise all along that contributed to the healing of the patients. So once this study shows which one is better, if either of them are good at all, clinicians can then better understand which modality will work, and further research can be done to say uh, then which modality can be paired with different types of treatment, different other modalities, other exercises to give an overall better treatment plan, a treatment protocol for Achilles tendinopathy. There were no limitations to this study other than the patient honesty during filling out the questionnaire and the pain scale. They could have just been having something as simple as a bad day, and it affected their judgment and where they marked their answers down. And then there's also human error, not only of the patient, but of the researcher as well, collecting the data since it is done by pen and paper. That's it. I hope this has been informational to you. If you have any questions, feel free to contact me. Thank you for your time.